Hi, I'm Dr. Frank Scacia. The purpose of this video is to welcome you to my website and also to give you a little overview of our philosophy behind the care that we provide at our center here, Riverside Plastic Surgery and Sinus Center. I've been in practice for over 25 years. I've been at this center that I opened myself in 2001, which is unique in that it's both an office, and we have attached to it right down the hallway our own Joint Commission and state license approved surgery center that is constructed and specializes in things that I perform, which is mostly rhinoplasty, facial plastic surgery, sinus surgery. I'm very proud to be here. I'm proud of all that we've done to the community. I think we provide some very unique services in that we're one of the few and one of the first ones to offer Brainlab navigational sinus surgery. That is a device that we have in our operating room that uses laser-guided infrared technology that allows me to be very accurate and to safely navigate through the sinuses when I'm doing sinus surgery. My interest is the nose. Both aesthetically and improving the appearance of the nose, and also to make sure that it functions well. I think often surgeons will concentrate on one or the other, and I think it's important that you have a nose that works well and that also looks well. There are no shortcuts in our practice. Every patient is I spend a lot of time with. Every person is an individual. There's customized treatments. This is not a factory type of practice or chain type ENT practice. This is more like a boutique kind of service where we take our time with our patients, whether it's 20 minutes, half an hour, or an hour, whatever it takes to do a nice history and physical, and to acquire all the information we need to treat you to the highest quality and standards possible. If a patient is a candidate for surgery, we of course take that very seriously. We make sure the patient is we want to be assured that they're going to have a good outcome and that everything's going to be done safely. Often the insurance can be covered by insurance. We make every effort to make not only the surgical experience but the financial experience as good as possible. Again, when I perform my surgery, I usually only perform one surgery a day, especially if it's a long one. I feel that I don't want to be one of these type of surgeons who's knocking out, as you may say, 2, 3, 4 procedures a day. I don't want to feel rushed. I want to feel like that I want to spend as much time as it needs, as necessary, to get the perfect result, if that's even possible. I don't leave the operating room until I feel that I did everything possible to get the best outcome that can happen. I mean, perfection is not always guaranteed, but that's my goal. I will often, occasionally at times when I'm doing a procedure, especially cosmetic or a rhinoplasty, if I notice something that's not quite right, even though I'm just about done with the procedure and it's sutured, I'll take the sutures out and open it up and fix whatever little thing I saw to make it that much more perfect. So there's no rushing, both when I'm evaluating patients in the office. I see all the patients myself. I don't utilize physician extenders or nurse practitioners or physician assistants, although I feel they do have a role in medicine, and there's a lot of very good ones. In my office, I take full responsibility. I even take my own sutures out. And I use loop magnification, microscopes for a lot of the things I do in surgery, and also even taking sutures out or removing little lesions. My nurses are very high qualified. They've been with me for many years. Most of my employees have been with me for many years because they enjoy working here, and I think they enjoy seeing the results that we get. It's almost like a family atmosphere here. You're treated like one of the family. I'm always available for everybody, 24 hours a day. And again, my goal is to give everybody the best result possible, whether it's something medically I do in the office using pharmaceutical agents, or whether it's a surgical procedure that I have to perform. Again, my specialties are ear, nose, and throat, especially within the subspecialty of that involves sinus surgery, disorders of the nose, breathing problems, nasal obstruction, snoring, obstructive sleep apnea, and the full gamut of facial cosmetic surgery, which would include facelifts, otoplasties, pulling the ears back, blepharoplasty, eyelid tightening, lip enhancement. I was one of the first to use the technique of advancing the lips permanently by using an incision along what we call the vermilion border to permanently reshape the lips. This is done in only certain cases, but having confidence and using a meticulous technique, we're often able to take very thin lips and enlarge them to nicer, fuller, sometimes voluptuous lips. Again, I'm just welcome everybody to my office. Please feel free to visit the rest of the website and look at the photo gallery and read about all the procedures we do. And I think you'd be very happy coming here if you have a condition that is one of the specialties that I treat.